Okay.
and make an intelligent question, an intelligent...
But as far as the look, will they look the same?
Look-wise, they look absolutely the same.
Okay.
Feel-wise, it really depends on how much breast tissue do you have to begin with. If you're absolutely flat-chested and you put silicone, put a saline implant, you will feel the edges of the implants.
Okay.
So depending on how much breast tissue you start with, because what it
that
is,
happens on the consult, obviously. You look
absolutely.
at them and...
But what it is that the more breast tissue covers the implant, the less you're going to feel the implant. So if you got skin, breast tissue, muscle, and you got plenty of that, it doesn't matter what's really under it.
Okay.
It could be water, it could be silicone. So during the consultation, after the examination, I tell them what the advantages and disadvantages are, and then I tell them what I think they should choose.
Okay, okay. Now, breast lifts. After pregnancy...
Breast drop,
yeah.
Correct.
But I heard it's a very tricky procedure.
It's a very
with
tricky
scarring
procedure.
And things like that.
Well, the scars can be handled, but the tricky part of the procedure is you're augmenting and you're tightening. So it's a yin-yang thing. You're fighting two forces, two opposing forces, and there's a balance. There's a fine balance, and that's where it gets tricky. If you put a too big an implant in a small breast that you're trying to lift, you will have problems. Or if you try to remove too much skin over a big implant, you have the same problem. So there's a fine point, and that fine point turns out to be what size implants again you need to choose for that patient.
Okay.
And that is...
Now, some women with saggy breasts after pregnancy, some need some type of revision, some don't. Does that depend on how saggy they are? What?
Depends on how far the nipples have dropped in comparison with the fold.
Okay.
And whether they want to have a more of a rejuvenated look or more of a natural look. And how much scar are they willing to carry on their breasts? Because breast lift procedures come in a variety of forms and shapes. You can start with just a simple incision around the areola, around the nipple, and that may be just enough for somebody.
Okay.
And in some other people, you may have to take that scar vertically down to the fold. And in some other people, where the breast has dropped a lot more, you may have to go along the fold in the form of a ship's anchor.
Are these women afraid of that? Is that a big concern, the scar tissue after a lift?
No.
Because I've seen yours, by the way. We're going to show yours.
If you take care of the scars, and the scars fade away, they're absolutely okay with it. Randy, let me show you some examples of lift and augmentation.
Okay.
Very tricky procedure. Here's a middle-aged lady who has had 2 children. She has breastfed, and you can see that the breasts have dropped. You can see that the nipples are below the fold. Here's the fold. Here are the nipples.
So is this something you see a lot of?
I see a lot, and I want you to see the asymmetry. The right breast is a lot longer and has dropped more than the left breast.
Yeah.
And let's move on to the postoperative picture. And you can see how the volume has been restored.
It's very nice.
How the breasts have been pulled up. And I want you to look at that cleavage.
Yeah.
Very natural cleavage. And look at the scars. What do you think about the scars?
Yeah, you can't really see the scars.
The scars have faded away.
Put them?
They're right there. They're around the areola.
These are not touched up photos?
I have not touched up these photos. Good question. No, I have not touched them up. They're there.
I mean, this is a big
And this is only
difference.
about 6 weeks out of the procedure. See, only 6 weeks after the procedure.
So what will happen as they go? They just become
fade
more
away.
natural and more natural?
The scars will fade away further and further, and you can see that the scars around the areola are almost imperceptible.
Okay, a few more we have time for.
Well, the next lady, younger, the breasts have dropped.
Wow, that looks like an older woman.
Well, she's not, but she has been breastfeeding, and she's had actually 3 or 4 children, this lady, and you can see there are quite a few stretch marks. That tells me that at some point she had quite a bit of a volume. She lost the volume as she went through the pregnancies afterwards.
Were
and all
her
that.
fears scars?
Absolutely. She was very fearful about the scars. And at some point I had to tell her that by just putting implants in there and not doing any lift, she would end up with a very, very saggy looking breast. And that would be the wrong path for her to take. So it took me some convincing to get her to accept the scars.
When you see this, by the way, do you say, oh, this will be good? In your eye.
Well, I know exactly what I'm supposed to be doing. I know that I'm
but do you see it as an end result?
Absolutely,
oftentimes?
absolutely. Because I know that the implant has to go and the breast has to be lifted. So I know that I have to talk to this lady about scars.
Okay.
And Here's a postoperative picture, and she's only about 4 weeks out.
She's got to be happy.
She's very happy. She has the volumes restored. The volume has shifted upward. The scars you can see around
It's
the
nothing.
areola are
I mean,
very
really,
imperceptible.
And these are not touched up.
And these are not touched up, and you can see how the scars, even the vertical scar that goes from the areola down to the fold, it's faded away. Randy, I want to show you a few more ladies. This lady has the same story as the previous one. You can see the nipples have dropped.
Are these younger patients?
She's about the same age as about the other
Like 30.
one. But you know, baby boomers.
So after pregnancy,
After
breast
pregnancy,
tissue just
the breast
drops.
tissue just completely lost, and the breast just dropped, and they were unhappy. And she exactly was one of those ladies who came in with pictures of her, you know, back in the college days, you know, before having children, and she had nice large breasts. She was probably a cup C, you know, looking at those pictures. Now she may be a C, but the volume has shifted completely down. So she completely relies on bra.
So what do you do for her?
Well, I ended up doing a very short scar lift and an augmentation. And I want you to look at this picture and see how natural they are.
Yeah.
The scars are beginning to fade away. She's only a few weeks after the surgery.
Very nice.
But what I want you to look at is the tan line. This lady has been out there enjoying herself now.
Okay.
So
yeah,
she's
so
been
they're
out
wearing
there.
bathing suits. They're out and about.
Absolutely. Absolutely.
Good.
She's absolutely out there enjoying herself. Do you have time for one
Sure,
more?
go ahead.
Okay, here we go. This lady is a little bit more challenging, and it's obvious.
Why? Why is it
Well,
challenging?
besides the usual stuff that the nipples have dropped, the areolas have widened, and you can see that the left breast is completely longer and has dropped significantly more than the right breast. So now, not only I have to restore volume, bring the nipples back to their natural position, I also have to make sure that they come out very, very symmetric. Now, let's take a look at the postoperative picture. I used a moderate sized implant for her because she had plenty of breast tissue to work with. So I didn't have to use a big implant on her, which was very nice for her. And you can that's a very natural
It's almost
look.
like a perfect
That's a very natural
job.
look.
I mean, perfect breast.
Well, I'm glad you agree with that because, you know, that's a very natural look to me.
Yeah, it doesn't look
look overdone.
Yeah.
It doesn't look overdone. You can see the nipples are even.
Okay.
Whereas before one was a lot lower than the opposite side. And again, you know, the scars turn out to be very nice. What do you think about the scars?
Yeah, I mean, it looks good. How many weeks out is this?
She's about 6 weeks out. And you know that, you know,
they just fade over time.
In time, in a matter of months or weeks, they will fade away to become almost imperceptible.
Now, those are serious tan lines there,
and
by
she's
the way.
been out there again, you know, she's been enjoying herself. And this is a young lady you can probably see out there, you know, just tanning on the beach.
Good, good. We're out of time. And very good. A lot of information today. Final message. Somebody watching this, a woman watching this, unhappy with her breast. Where does it begin?
Call the office, make an appointment. My nurse and I will be more than happy to see you and go over the issues at hand with you. It's best to pick a surgeon that listens to you. Don't let the surgeon necessarily dictate the size of the implant. Don't be afraid of getting a lift. At the end, what matters is whether you look good in clothes or not, basically.
Okay, good, good. I want to thank you for coming on the show. Very, very,
thank
very
you,
interesting.
for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. All of the before and afters on this program could be seen on the doctor's website. If you'd like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.